The SCAT6 is a tool used by healthcare professionals to evaluate concussions. The SCAT6 is ideally used within the first 72 hours following injury. There are two versions of the SCAT6, one designed to be used on adults or children above the age of 12, and a child SCAT6 for children 12 and under. It is recommended to perform the SCAT6 on your athletes to get a baseline test, but not required. Instructions are provided and should be read through before beginning testing. Athletic tape and a timer are needed for testing.
To start the SCAT6, the medical examiner will fill out patient information and get concussion history located on the second page of the SCAT6 form. This information should be known before the injury. It is important to be able to recognize concussions. They may occur from a direct blow to the head or transmission of force to the head, which can become fatal if not treated properly. If the athlete presents with symptoms in the red flag box in box 1, the athlete requires immediate medical attention and should be referred to the nearest medical facility if the medical practitioner is unavailable for immediate assessment.
Testing begins with observable signs found in step 1. These are things you may have witnessed live or observed from a video, such as lying motionless on the playing surface, falling unprotected on surface, motor instability or problems with balance and gait, disorientation or confusion, a blank or vacant look, facial injury after head trauma, impact seizures, and high-risk mechanism of injury.
Step 2 of the SCAT6 is the Glasgow Coma Scale. This is only assessed once. During this portion of the SCAT, we are looking for eye response, verbal response, and motor response.
In step 3, we are looking at the cervical spine. If the patient is unconscious or lucid, a cervical spine injury should be assumed and treated as such. If they are conscious, they should be asked about neck pain, tenderness to palpation, active, pain-free, full range of motion, and limb strength and sensation.
In step 4, we are testing coordination and ocular motor function by having the patient touch their finger to their nose, starting away from them, and having the patient look side to side and up and down with just their eyes.
During step 5, we are testing their memory by asking Maddox questions. The medical examiner should read the instructions given to the athlete. These questions are items such as which venue the athlete is currently in, what half of the game it is, who scored last in the match, what team did they play last, and if their team won their last game.
Steps 1 through 5 are all found on page 3 of the SCAT6 form. To begin the SCAT6, you want to get the athlete's background information. This includes if the athlete has ever been hospitalized for a head injury or diagnosed with a learning disability or dyslexia.
To begin, I'm going to ask you some questions about history. Just give me yes or no answers. Have you ever been hospitalized for a head injury?
No.
Have you ever been diagnosed or treated for headache disorder or migraine?
No.
Have you ever been diagnosed with a learning disability or dyslexia?
No.
Have you ever been diagnosed with attention deficit hyperactivity disorder or ADHD?
No.
And have you ever been diagnosed with depression, anxiety, or other psychological disorder?
No.
What current medications are you on?
I don't take any medications.
And is there anything else I should be aware of?
No. So I'm going to list a few symptoms for you, and you're going to rate them for me based on how you feel right now. 0 meaning you don't feel that symptom at all, and 6 meaning that's the most severe you've ever felt the symptom, okay? Headaches.
5.
Pressure in your head.
3.
Neck pain.
4.
Nausea or vomiting.
4.
Dizziness.
3.
Blurred vision.
0.
Balance problems.
4.
Sensitivity to light.
6.
Sensitivity to noise.
4.
Feeling like you're slowed down.
3.
Feeling like you're in a fog. I like to describe it as if you went underwater.
3.
Don't feel right. You just don't feel like yourself.
5.
Difficulty concentrating.
5.
Difficulty remembering. Fatigue or low energy.
5.
Confusion.
3.
Drowsiness.
6.
Feeling more emotional. 4. Irritability.
5.
Sadness.
5.
Nervous or anxious.
6.
Trouble falling asleep.
3.
Okay, and do your symptoms get worse with physical activity?
Yes.
And do your symptoms get worse with mental activity, so like during the class day?
Yes.
And if 100% is feeling perfectly normal, what percent of normal do you feel right now?
67.
And why not 100?
I don't know.
Just don't feel like yourself?
Yeah.
Cognitive screening testing orientation and immediate memory.
I'm going to ask you some questions. Answer to the best of your ability. What month is it?
It is July.
What is the date today?
The 19th.
What is the day of the week?
It's Wednesday.
What year is it?
2023.
And what time is it right now within the hour?
It's about 10:15.
Okay, I'm going to test your memory. I will read you a list of words, and when I'm done, repeat back as many words as you can remember in any order.
Okay.
Are you ready?
Yep.
Jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Apple, arrow, saddle, jacket, anchor. That's all I remember.
Okay, I'm going to repeat the same list. Repeat back as many words as you can remember in any order, even if you said the word before in the previous trial. Are you ready?
Yep.
Jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Apple, jacket, mirror, honey, saddle. That's all I remember.
Okay, we're going to do it one more time. Repeat the same list. Repeat back to me as many words as you can remember, even if you said the word before in a previous trial. Ready? Jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Dollar, saddle, anchor, mirror, honey, apple, jacket. Did I say saddle?
Yes.
Yeah, that's all I remember. In the cognitive screening testing concentration, the practitioner will administer it at the rate of 1 digit per second, reading down the selected column. If a string is completed correctly, they will move on to the string with the next higher number of digits. If the string is completed incorrectly, they will use the alternate string with the same number of digits. If it is failed again, they will end the test. The practitioner will then move on to the test of months in reverse order. Okay, so I am now going to give you a series of numbers, and you're going to repeat them back to me backwards. So if I said 1, 2, 3, you would say 3, 2, 1. And if I said 4, 5, 6, you would say 6, 5, 4. Okay? 5, 9, 3.
3, 9, 5.
3, 8, 1, 4.
4, 1, 8, 3.
6, 2, 9, 7, 1.
1, 7, 6, 9, 4.
1, 5, 2, 8, 6.
6, 8, 2, 5,
7, 1, 8, 4, 6, 2.
1. 2, 6, 4, 7, 9, 1.
5, 3, 9, 1, 4, 8.
841-593.
And now you're going to tell me the months of the year in reverse order, starting with December, and I am going to time you, okay?
Okay.
So whenever you're ready.
December, November, October, September, August, July, June, May, April, March, February, January.
Next is the modified best and timed tandem gait. Okay, so now we're going to work on balance. And so I'm going to time you for each of these tests, and I'm just going to watch and make sure that you don't have any errors, okay? So first, you're going to do a double leg stance. So you're going to sit with your feet together, hands on your hips, and you're going to close your eyes, and I'll tell you when to start. Okay, ready? Go. Okay. All right, so next, what's called a tandem stance. So if you were to kick a soccer ball, which foot would you use?
Right.
Okay, so we're gonna test your non-dominant foot. So you're gonna put your right foot behind your left, just like this, heel to toe. You're gonna stand with your hands on your hips, and you're gonna close your eyes. Ready? Go. Okay. And again, we're gonna test your non-dominant foot. So you're gonna stand on your left foot, hands on your hips, and close your eyes, okay? Ready? Go. All right, so next you're going to walk in what's called a tandem gait. So you're gonna walk heel to toe as fast as you can using the white line, and then you're gonna turn around and come back as quickly as you can, and I'm gonna time you, okay? Ready? Go. And come back as fast as you can. We're gonna do it 2 more times, so let's do the second one whenever you're ready. Come back as fast as you can. Good. Okay, and now we'll do it 1 more time, whenever you're ready. The final test is a test of delayed recall.
Do you remember the list of words I read a few times earlier?
Yes.
Okay, tell me as many words from that list as you can remember in any order.
Mirror, arrow, dollar, saddle, jacket. That's all I remember. Once the SCAT6 is completed, the practitioner will compare this test finding to those of the baseline test if it was obtained. The practitioner will use that comparison to make a decision and begin treatment if needed.